Welcome to the webinar. The session will begin shortly, so please make yourself comfortable. If you have questions for the panelists, please write them in the question box via Zoom. And please do not forget to mention your name. You can also share your participation in the webinar on social media using the hashtag #leadinglocalization and tag @AsiaPrepared via Twitter and Facebook. The sign language interpreters will provide interpretation for the session. The COVID-19 pandemic has introduced a new normal and reshaped the perspective of humanitarian interventions. Local actors are increasingly being recognized as one of the most important implementers that greatly influence the effectiveness of any operation. They play a unique role and position in preparing for, responding to, and recovering from various crises. Their efficacy is ingrained in their experience at the grassroots level, which provides them with immediate access, relevant interventions, and comprehensive understanding of the needs and aspirations of local communities. More importantly, they are at the forefront of designing and implementing development interventions that target vulnerable populations. Good afternoon, everyone. Thank you for joining us today here at the webinar Leave No One Behind, organized by the Asian Preparedness Partnership, or APP. I am Edwin Salonga of the Asian Disaster Preparedness Center, ADPC, and I'll be your moderator this afternoon. Today, we will discuss the experiences and good practices of local actors from different regions in working with vulnerable populations and adopting COVID-19 sensitive disaster management strategies. We will also identify recurring themes in resilience building towards the fulfillment of the global aspiration to leave no one behind. And we will foster knowledge sharing on good practices in disaster risk management. This webinar on Leave No One Behind will feature key representatives and experts from APP countries such as Sri Lanka, Southeast Asia, specifically Indonesia, also Africa, Ethiopia, and the Northwest Syria NGO Forum, as well as the Raoul Wallenberg Institute in Sweden from Europe. In addition, the Bill and Melinda Gates Foundation will provide a global perspective on localization. Our distinguished panel of experts will highlight good practices on resilience building among vulnerable populations in the backdrop of the COVID-19 pandemic and complex emergencies. We are fortunate to be joined by our first speaker, who is a retired military official, serving as the Director General of the Disaster Management Center, DMC of Sri Lanka, is Major General Sudanta Ranasinghe. Concurrently, he serves as the Additional Secretary of Disaster Management Division at the State Ministry of National Security and Disaster Management. He is also the Director of the National Disaster Relief Services Center of Sri Lanka. He brings with him over 4 decades of experience in the military and government service. Good afternoon, Major General Ranasinghe.
Good afternoon and good morning from Sri Lanka, and thank you very much for having me here.
Sir, let me ask you to start our ball rolling. What strategies or policies in Sri Lanka employ the whole of society approach in disaster management, especially now that we are in the midst of the COVID-19 pandemic?
Yeah, so I will not go for a preamble or an introduction, so I will go straight into the subject because time given is 6 minutes. So, engaging the whole of society in disaster risk management is a well-practiced and enhanced process in Sri Lanka. Though we have all types of disasters covered under the Disaster Management Act of Sri Lanka, including pandemic situations, we never expected or had plans for a pandemic situation of this magnitude. And being a small island nation with an effective public administrative system, as well as an efficient health and hospital chain, we had a working network to adapt and improve on once this situation strike. However, the main issues we faced were the awareness of the intensity of the pandemic, educating people on the new normal, and enhancing the capacity in material and rapid testing as well as vaccination. As indicated in the concept note of APP, one size does not fit all, and disaster response must be executed by those who understand the needs of the community was well understood by the government, and we have been practicing that. But educating the local actors on this role and task with specific reference to COVID-19 pandemic scenario and concept of new normal was not easy at the beginning, and it took time. So government was compelled to introduce all types of restrictions and regulations as per the advisors of health authorities, employing the whole of the society and managing the needs and basic living of all citizens. So government brought in all responsible agencies, endorsing the main responsibility to the health sector. So Disaster Management Act and the Quarantine and Prevention of Disease Ordinance was put into immediate effect, and we have been practicing that to a good effect. But the special presidential task force was commissioned immediately in order to have the action plans right down to the last man, leaving no one behind. Special Economic Revitalization Task Force was also appointed to make sure the management of uninterrupted supply chains, MSMEs, farmers, and people who live in daily wages. Immediate health protocols, algorithms, and guidelines were declared, advising and taking all stakeholders and mainstream ministries with dedicated priority of work within their own responsibility. I must note that Sri Lanka is one of the few countries in the region who controlled the first wave of pandemic successfully by taking very stringent decisions. However, with the weakening finance and economic situation due to mediocre functioning of businesses, production sector, agriculture, tourism, etc., for over 24 past months, country faced numerous difficulties, mainly in falling of foreign reserves and currency, restrictions on import-export trade and businesses. Hence, we were compelled to open up in beginning of 2021. With the opening of the airport, the disease hit the entire country, making second and third waves impacting all 25 districts of the country. However, the robustness of the Sri Lanka health system, which has a long history of strong performance and impressive health outcomes, was committed to ensure optimum health of the public, along with strong political leadership, top-down and bottom-up approach, while ensuring whole of government, whole of the society response throughout the pandemic. The National Pandemic Preparedness Plans was activated by the Epidemiology Unit in early January 2020, while plans and structures were developed and put in place with the highest level of political commitment, leadership, and multi-sectoral participation. The National Steering Committee was appointed by the President, which brought together a range of stakeholders in addition to the health sector on the COVID-19 response. This involved the Ministry of External Affairs, country consulates, the Civil Aviation Authority, airports, the Ministry of Defense, Department of Customs, Department of Immigration, the Ministry of Finance, the Disaster Management Center, and Ministry of Ports and Shipping, to name few. The diagnostic facilities of COVID-19 was first established at the National Reference Laboratory at the Medical Research Institute, later strengthened this service all around the country. Government set up a presidential task force to prevent the spread of disease. The task force, headed by the Commander-in-Chief of the Tri-Forces as the operational lead and Ministry of Health and the Director General Health Services as the technical lead, and it brought together various government bodies, including Disaster Management Center, to coordinate the response together with connected disasters and weather-related situations. So in response to the pandemic, the Ministry of Health initiated several activities as per the response plans of all relevant agencies coming under the military, where DMC also took a major part. Technical committees for COVID-19 response, advisory committees on communicable diseases, and National Pandemic Influenza Steering Committee also provided technical guidance for decision-making process, which went right down to the local levels. So government cancelled all public events. The curfew was enforced, but subsequently now the curfew is lifted and the country is slowly opening up as at now. So economy is getting back to normal, and now we are getting back to normal working routines. The schools will be open soon, and the universities also will be open soon. So the Special Presidential Task Force established to coordinate and monitor the delivery of continuous services of the sustenance of overall community life, lead the welfare services from the government, handed over 5,000 Sri Lankan rupees per family per month during last few months. At the same time, the task force ensured the raw food production and canned fish and dal and other essential requirements on the door-to-door supplies, and mobile vendors distributed various requirements of people to their doorsteps. Immunization was initiated early, and massive campaign is conducted through health sector supporting with the support of Tri-Forces and the community as well. The community-based hospital, community-based hospital quarantine and home-based vaccination is also conducted, leaving no one behind. 24/7 vaccination programs were conducted by Tri-Forces to ensure the speedy conclusion of the immunization to the entire country. We are very successful in our immunization program. So while having ongoing pandemic response activity, which is overwhelming the capacity of the country, we had to further concentrate with annual weather-related events, especially monsoon rains and consequences. As every country in the region, we had to take extraordinary measures together with the stakeholders, ensuring value for people. The most difficult part faced was conducting pre-monsoon activities and response work, which couldn't be done virtually. Under the National Disaster Management Plan, local administrative actors as well as local authorities, that is the political arm, are engaged to develop the respective disaster management activities, including epidemics such as dengue and malaria as at now. Number of awareness programs, media campaigns were conducted, and leaflets were distributed to acclimatize communities on disaster management with COVID-19 and upcoming northeastern monsoon.
Wow.
And the National Disaster Management Plan as well as National Emergency Operation Plans were updated to coordinate with the health emergency situation to cope with any climate or weather-related calamities to time to come, because we are at the doorstep of the next northeastern monsoon, which we are expecting above normal. The disaster management agencies at local level have been working with public administrative agencies at district and local level for past many years to enhance their capacity to handle such calamities under any adverse situation. The existing plans are very useful and help all local actors to coordinate and respond to unexpected. So, finally, I would say that we have been through with this pandemic situation for the last 2 years almost, and we faced 4 serious monsoons. We had number of situations. However, disaster management action plans connected with health authorities, health guidelines, health algorithms, and with the government task force have been very successful. We did not have serious situations connected with disaster calamities and COVID-19. So we have been very successful handling disaster situations and natural calamities together with the pandemic situation in Sri Lanka. So finally, let me invite you, because Disaster Management Center is glad to announce that a national event to commemorate the International Day of Disaster Reduction has been scheduled on 13th October in partnership with the Sri Lanka Preparedness Partnership under the regional initiative of Asia Preparedness Partnership, Asia Disaster Preparedness Center and University Huddersfield. As an eminent panel of local and overseas professionals and academics will share their views and experiences at the event, and the topic of under the topic of only together can we save the planet. So I invite all of you to join us on 13th October. Thank you from Sri Lanka.
Thank you very much for that insightful discussion, Major General Ranasinghe. And also thank you for inviting us in celebration of the 2021 IDDRR. Given the increasing intensity and magnitude of emergencies nowadays, it is really crucial to employ a whole society approach in disaster management. Thank you again, sir. And our next speaker is Dr. Matthew Scott. He is a senior researcher in human rights, disasters, and displacement at the Raoul Wallenberg Institute of Human Rights and Humanitarian Law in Lund, Sweden. He is a member of the advisory committee on the platform on disaster displacement. Credited with numerous publications under his name, please help me welcome Dr. Matthew Scott.
Thanks for the kind introduction, Edwin. It's a pleasure to be here. I'll keep my remarks short with regard to the time. The Raoul Wallenberg Institute, an academic institute committed to promoting understanding of and respect for human rights. And the first question that the audience might be wondering is, what does an international lawyer have to say about localization? I'll give the answer to that in the next few minutes. So from the perspective of an international human rights lawyer, good practice entails the integration of a rights-based and gender equal approach in national and subnational legal and policy frameworks, whether that's relating to sustainable development, disaster risk reduction, climate change adaptation, or an integrated combination of those, including even public health law and policy when we think about coronavirus pandemic. The idea of integrating these core principles of human rights and gender equality takes us a long way towards identifying the kinds of measures that should be taken in order to leave no one behind. And the perspective that a rights-based and gender equal approach invites is a recognition that disaster risk reduction, emergency preparedness, pandemic preparedness for response is not an issue about charity, but it represents the responsibility of authorities to protect people from foreseeable harm, using the maximum of available resources and ensuring, actually taking steps to ensure that no one is left behind. And that's a slogan that's become familiar within this field as well as in other fields, thanks to the success of the Sustainable Development Goals campaign. But what it means is not treating communities as homogeneous units, but seeing the differences within societies and trying to understand, first and foremost, what are the conditions that create the different kinds of exposure and vulnerability to harm, and also introducing mechanisms to reduce those root causes. But that's a long game. The shorter term requires the articulation of legal and policy measures, which have some of the following features, which are characteristic of this rights-based and gender equality approach. Those features include a requirement to have meaningful and active participation, not only of the community, but of women and girls, boys and men. It includes having particular regard to indigenous communities, migrant communities, people from a range of backgrounds, including people in remote areas, as well as people in informal urban settlements. It means that active and meaningful consultation, as well as providing opportunities for people to take a decision-making role in issues that affect their lives. There's also a critical aspect of access to information so that people can make decisions and take the necessary steps to protect themselves, for instance, from epidemic risk. The other aspect of this approach is that it focuses on specific protections, thinking about the right to health, the right to clean water and sanitation, the right to adequate standard of living, the right to adequate shelter, having recognition of the fact that in many countries of the world, this is a challenge of progressive realization. It takes time and it's difficult to achieve with resource constraints and other obstacles. But in a study looking at the legal and policy responses to COVID-19 that we conducted with the Office of the High Commissioner for Human Rights, we looked at 14 countries and found that none of the legal and policy responses in those countries systematically integrated this human rights and gender equal approach, but we found numerous examples of good practice in different contexts. Since we have representation from around the world on the panel, I'll focus on some examples from Latin America in the 1 minute that I have left. And two examples come from Ecuador and Costa Rica, reflecting that idea about access to information. The response from Ecuador was to systematically and consciously target communication to indigenous populations in a manner that brought in the communities themselves to discuss and design the communications modalities. So it was not only tailored in terms of language, but also the way the message is communicated so that it can be received and acted upon by people in those groups. Another example comes from Costa Rica, where the authorities in that country designed targeted response plans for different groups, people in different kind of situations of potential vulnerability, including specific plans for persons with disabilities, people of African descent, migrants, as well as persons deprived of their liberty. So that example in particular highlights the need to move beyond a slogan of leaving no one behind towards an active initiative to take specific steps to target people who are differentially exposed and vulnerable to various kinds of harm. I'll leave it at that.
Thank you, Dr. Scott, and we appreciate the examples that you have provided. Indeed, it is important to investigate how vulnerable communities are affected by the COVID-19 pandemic. I'm sure our webinar participants are eager to know more, so please just stay in, Dr. Scott, and we'll ask you follow-up questions later on. But at this juncture, let me introduce Ms. Sri Kusuma Hartani. We call her Dr. Tani as our next speaker. She is an Indonesian medical doctor who pursues her passion for preventive works and partnerships. With over 15 years working in the NGO sector and as an independent consultant, Dr. Tani managed the Lean On by Invest DM initiative from 2020 to 2021 to model inclusive COVID-19 risk communication and community engagement convened by the National Agency for Disaster Management, or BNPB Indonesia, with support from the USAID. She currently serves her 6th year as the executive board member of Mercy Corps Indonesia. Welcome, Dr. Tani.
Thank you. Mabuhay, Edwin.
Mabuhay. And let me ask you, Dr. Tani, how has the Lean On program by Invest DM addressed access of COVID-19 information and services for marginalized communities in selected areas around Indonesia? And could you share some of the results?
Of course, Edwin. In fact, I have prepared some slides to help me show and share the how and also some of our key results. So ladies and gentlemen, good afternoon. Very nice meeting everyone. Lean On, or Leaving No One Behind, was an inclusive risk communications and community engagement by InvestDM as a response to the pandemic. The initiative was directly convened by BNPB, which is the Indonesian National Disaster Management Agency, with a sub-award to Mercy Corps from the program named Empowering Access to Justice, which is a cooperative agreement between USAID Indonesia and the Ministry of Law and Human Rights. Mercy Corps Indonesia led the in-country management and implementing partnerships of the 13-month response. Next slide. Let's meet Nikki, Edwin, and dear listeners, our partner from Disable. It is a local foundation that focuses on training people with disabilities to become private workforce, gig workers, or entrepreneurs. And Lean On was their first emergency response partnerships at large scale. Lean On had them as one of our main partners because they know the gaps in COVID-19 information and services that their peers and communities are facing. And they have existing networks of caseworkers and social work students to be deployed in Greater Jakarta and Greater Bandung. Disable, along with all of our partners, mainstream the nothing about us without us spirit in Lean On partnerships. Next slide. Now, if you look at this, can you spot the difference? Really quickly, yes.
Oh, the face.
Yeah, one has mask and the other doesn't. So during the pandemic, Hermin here was one of our 80 caseworkers that Lean On recruited in Greater Solo of Central Java. Her right leg and foot was affected by polio, but that physical disability doesn't stop her from reaching out to senior citizens, people with disabilities, and other vulnerable members of the communities who are in need of information and a safe ride with her custom motorcycle to essential services, including during the pandemic. For sure, we did provide some monthly transport allowance and stipend for carrying specific outreach, digital reporting, and coordination with relevant public services and government officials. But Hermin and others has been active citizens who advocate for equity for a long time. So even when Lean On ended, Hermin activities for the program participants and more continue. Next. Now let's meet Noviati, the female on the left. She's from Wonogiri district, who is actively battling false rumors and information surrounding the pandemics. She made sure Bu Sarni, an elderly who lives with her son with psychosocial disability, and others like them, are not left behind in the fight against COVID-19. Next. Novi went to remote villages to coach people like Bu Sarni on health protocols and made sure they could access government support schemes, including livestock distribution for poor households and access to wheelchair for some others. Next. Lean On team safely navigated the outreach despite the dynamic social mobility restrictions. Can you go to the previous slide, please? Yeah, thank you. With proactive coordination with the local authorities, as can be seen in the photo. That way, each caseworker could reach up to 330 participants from the vulnerable groups. And because we're working with vulnerable groups, and although some of the caseworkers might have been trained in safeguarding by their organizations before, it was still mandatory for each and every Lean On team members, including the partners, even desk officers, to all be trained on gender, safeguarding, prevention of exploitation and abuse, and community accountability reporting mechanism. And we also had monthly check-ins on those. Next. you will see two photos of group counseling sessions. One was with a group of trans women and the other with a group of local citizens in Greater Surabaya. You might won't be able to tell, but both caseworkers are actually trans women. They are members of local transgender associations who are active counselors of peer living with HIV before they were engaged by Lenon. Every community stay educated, find them supple and reliable in COVID-19 risk communications. People of all age and background in the bottom of the pyramid find them as their go-to person for timely information on the pandemic and relevant social protection schemes. The Disaster Management Agency of East Java province, who leads the COVID-19 handling in the region, even recruited them as first responders for general disaster management. Next slide. It was, of course, an unprecedented way of running a program, particularly emergency response. We relied so much on remote and virtual coordination, starting from a weekly one to an every other week meetings, while the outreach team mostly had to do offline counseling. Now that we learned that the one generic model has evolved into a personalized model by the 500 caseworkers for more than 160,000 marginalized people. And we are delighted to learn that knowledge practice and risk perceptions among the participants has improved in average by 30 percentage points. Last slide. Now, although the program has ended by August 2021, we still hear that the outreach continues by the caseworkers and some of the implementing partners. And Mercy Corps Indonesia is proud to work ourselves out of the job as we facilitated not only the partnerships in the program locations, but also social cohesion that bridge societies towards inclusiveness. And you can see in the last photo here, this is the transgender communities working hand in hand with public health clinic volunteers doing outreach for a comprehensive and synergized pandemic handling in their location. Thank you. Over to you, Edwin.
What a wonderful program, Dr. Tani. Terima kasih. Those are fascinating results. It is important to note that the Lean On program by InvestDM provided access to valuable information and services for marginalized communities in Indonesia. I think I'm not alone in looking forward to seeing this program being replicated and scaled up in other countries as well. I would like to take this opportunity to introduce our next speaker. Mr. Iyad Agha serves as the Forum Coordinator of the Northwest Syria NGO Forum. He has over 15 years of experience in business and non-profit organizations. He is an experienced executive with a demonstrated history of working with the non-profit organization management industry. Thank you for joining us today, Mr. Agha.
Thanks for having me.
And let me ask you, sir, what were the key development initiatives that were implemented locally to support affected populations during the COVID-19 pandemic? Can you please share some experiences that enhanced the community resilience during this time of pandemic?
For sure. Basically, a bit of background on the forum and the way we operate in Northwest Syria. So basically, the forum is a mixed forum between NGOs and local NGOs operates in the area in Northwest Syria through the border from Turkey. So since the beginning, the whole implementation has been carried out mostly by the local actors who have access to the population in Northwest Syria. It's always been a struggle in Northwest Syria to address sustained solutions and durable interventions that can help in building the resilience of the community due to the nature of the crisis that we have. It's a prolonged conflict that's been waging for the past 11 years now. And we're always going back to the first stages of the conflict in which we have to intervene and work on basic needs rather than working in more sustained and development initiative. But nevertheless, always the local actors were promoting development initiatives, were promoting longer term sustained solutions that can help the population even beyond the humanitarian aid operations. And in case of anything would happen to the operation that currently is the lifeline of the whole population of Northwest Syria. So it's a very, very delicate place for us to operate in, and a very fine balance that we need to create due to the limitation that we have, and I mentioned earlier. In the pandemic, in the COVID-19 pandemic, we had it didn't hit Northwest Syria immediately. We had like a month delay, which actually enabled us to work more on our preparation. And especially that the local actors were acting on the front line did not have a specific pandemic experience before, and in which NGOs had the opportunity to prepare them upfront and to put new mechanism in work and new modalities to operate that can support and help in pandemic times. So one of the development initiatives that we have, so basically, in addition to the pandemic effect on health, of course, the direct one, but also have a dire impact on the livelihood of people because of, you know, the economic and the impact on the economic. So one of the things that we were able to see through the cooperation between NGOs and local NGOs and UN agencies is managing to have some of the interventions that we do for COVID itself to be done by the local communities by creating livelihood opportunities for them. So one of which is basically we had an issue with the PPEs, the preventive measures of preventive equipment, such as masks. And early on in the pandemic, it was really difficult to get them across the border. So therefore, we managed to have a development initiative in which some of the people who lost their job were able to work on producing cloth masks for the NGOs to help them in distributing and work on promoting the awareness about how to deal with the pandemic. So that was one of the initiatives that we carried on and actually helped a lot because we had a lot of people, communities were out of work and had to, to reverse to something else and something new. We carried that out whenever possible. So whenever we have a livelihood opportunity, we would do that and through the community. All of that were made possible because the local actors are in center of the mechanism and the coordination mechanism that's led by by UN and NGOs together. Having that access by the local actors to the local communities provide a better understanding of the community and what of the intervention that might work or might not. One of the other issues that we dealt with and we managed to know because of our work in the communities that it wouldn't work as much with the isolation centers. So the idea for having isolation centers for people who might be suspected cases, though it seems possible or normal, unfortunately in Northwest Syria wasn't because there was no, it wasn't well explained to the population and therefore they were afraid of using it. So actually operating with the local actors, understanding that uniqueness of the community helped in not pursuing this line and going ahead with investing big amounts of money that we desperately need in other areas. So back to the developments in general. So the local actors from the beginning always promoted and advocated for the use of a longer term solution. So when said for distribution, instead of having food baskets, they will always promote having livelihood projects that can enable the community to sustain themselves for longer term, and as well with wash and water sanitation and hygiene. So instead of water trucking, we have water station rehabilitation and enabling the community to sustain themselves beyond the program. Unfortunately, we weren't always successful in implementing the longer term solution due to the nature of the conflict. So the conflict's been waging for quite some time, and it's still there's armed conflict happening on the front line, and by default have its own impact on the population and on the way of our operation. So in addition to that, we had the obvious thing that we were working on is trying to get the capacity from the NGOs to transfer that capacity to the local actors who are frontliners in doing distribution in terms of pandemic. So we had the time to prepare for that. So instead of having the normal spots for distribution, we're doing something more fitting to the pandemics and say in camps, door-to-door sort of a distribution. And again, instead of water trucking, wherever possible, doing water rehabilitation or for the population so they can sustain themselves even when we're not there. And unfortunately, due to the impact of the pandemic globally, some of these lifelines were not there anymore for the population. Therefore, they have to depend heavily on these development initiatives. So I would say finally that all of that was made possible because the local actors were in the center of the operation and the center of planning. Therefore, we were able to accommodate the needs and the change base of the needs as well. On that, I'll be done. Over to you.
Thank you very much, Mr. Iyad Agha. Your development work is so unique given the conflict situation in Syria. And when you mentioned the borders, I think a lot of us has follow-up questions on your presentation, but we'll just get back to you for further inquiry later on. At this moment, among our distinguished speakers that I'll be introducing is Mr. Tadesse Bekele, who is a senior DRM advisor to the National Disaster Risk Management Commission, or NDRMC, of the government of Ethiopia. He has more than 4 decades of experience working for the government of Ethiopia in the area of disaster management. Thank you for joining us this afternoon, Mr. Bekele.
Thank you very much for the invitation. And
Sir, based on your experience, what key actions were taken to support vulnerable populations in Ethiopia during the COVID-19 pandemic and complex emergencies, ensuring that we leave no one behind?
Thank you very much. In fact, I'll be very brief in terms of the Ethiopian context. COVID was been confirmed March 2020. While this COVID was confirmed, we have had different complex emergencies. At that particular time, we have around 10 million people who were in transitory needy, expecting a multi-sectoral response in terms of water, health, agriculture, protection, nutrition, education, whatever. Again, beyond that, we have also some 8 million people who were the poorest of the poor, who were under the social safety net program. But again, at that particular time, we have been challenged with desert locusts, which really affected our agriculture because it was agricultural season. Again, at that particular time, we have a political transition. There was some uncertainties. Because of this, there were some conflict, and as a result of the conflict, we have internal displaced people. The drought as reoccurrence of hazard has been there, the flood, animal disease, lots of hazards. So this all combined created a complex emergency. So we're trying to tackle this complex emergency based on our disaster risk management policy. By the way, the policies that we had is very multi-sectoral, multi-hazard, very robust and comprehensive. And it had its own pillars like ensuring a paradigm shift from managing crisis to managing risk. It's more of proactive, multi-sectoral. So based on this disaster risk management policy, we have taken some strategic actions. The first actions that we have taken along with the complex emergencies, because COVID is anthropogenic hazard, and we have never had any experience, but we struggled somehow to address the situation based on the vulnerable people that had been targeted. So the first thing that was done was we activated emergency coordination centers, both at federal level and regional level. I remember our Public Health Institute was able to activate emergency coordination center even before we confirmed COVID. It was in January as such. Then this was managed by Ministry of Health, but as per the policy, when hazard goes beyond the capacity of sectors and when it's becoming a national concern, then the responsibility will shift to my institution, which is the National Disaster Risk Management Commission. Then this emergency coordination center was activated within the management of the Deputy Prime Minister, again, with the role of our secretariat, and all lead sectors. All lead sectors were full-fledged members in the bigger picture of the Federal Emergency Coordination Center. So based on this, we were able to prepare a national preparedness response plan, which was officially launched to the international community, to the government, to the private sector, to everyone who can contribute in terms of addressing the complex emergency. But again, more importantly, the government was also able to declare a state of emergency. This state of emergency was having an enforcement mechanism, and based on the state of emergency, very basic steps have been taken to mitigate the problem on the ground. And along with this state of emergency, the enforcement mechanism had allowed us to at least advocate, again, respond to, and prepare for the kind of complex emergencies that we have faced. Along with that, we were able to identify the role of the community, because formally, as I have mentioned, there are institutional arrangements to combat, but beyond that as well, we have the social fabric, which is based on our culture, that's the social responsibility, the social arrangement to address these problems. So for me, I would be more than glad to mention some of the critical steps that we have taken along with the complex emergency based on the declaration. We were able to limit the gathering of the people. In fact, to be very specific, more than 4 people are not allowed to be gathered. And we also downsized the number of passengers in both in public and private transport facilities. We banned public entertainment. We banned cinemas, recreation centers. Even never happened in the country. We were even forced to close our churches and mosques to reduce the risk. We closed borders. In fact, it was only open for cargo management. And even we imposed the public to take safety measures. When it comes to the public servant, up to 50% of the public servant were closed and to be at home, and government was committed to pay their salaries. Service sectors were being locked down. Manufacturing sectors have been downsized. Isolated quarantine centers have been organized. A lot of effort has been exerted. So this all effort has been done in a multi-sectoral approach, meaning all sectors were responsible to mitigate the complex emergency. If I pick our health sector, they were able to deploy their health work staffs. They built their capacity. They had their surge capacity. They were responding to emergencies. More of the attention in public sectors were being diverted, at least to minimize this pandemic. So this all has been done under the leadership of the Ministry of Health. When it comes to the Ministry of Education, that was a big challenge. At least when schools were closed, some 26 million children were out of school. When these 26 million were out of school, unexpected happening, really, it was really painful. We faced early marriage on our girls. We faced child labor on our school students. And for whenever we have food insecurity, we normally have school feeding program for those who are food insecure. So this school feeding program was interrupted. Livelihood was disrupted. So a lot of messes had happened. So based on the closure of school, it was really unexpected happenings were there. So we were able to manage and to timely address the situation. All other risk communication had been done. Radio, message, TV programs, cell phone ringtones, remind awareness, testimonial, spot message. All this were been done so that we were able to address our community in terms of the severity of the situation. So in all these areas, it was really successful. One thing I remember when we had this activation of the Emergency Coordination Center, it was a time where we were not able to have face-to-face conversation. So we were expected to equip our ECC centers both at federal and regional areas. So the ECC were furnished with ICT equipment with the support of BMGF and ADPC, not only the federal, but also 3 regions in the country were being able to be equipped. So that really helped us to have this virtual communication with all our partners and with all our sectoral and partner donor colleagues. So that needs to be thanked. But again, on the area where we were able to ensure the leave no one behind was by and large done more than the institutional arrangement by the public, I would say. The social fabric really allowed us to capture the most vulnerable people to be benefited from the kind of response that we give. As I mentioned earlier, the response is multi-sectoral, but again, multi-sectoral, yes, again, the response, the kind of response may need a targeting. So targeting can only be emanated from the social norms, the social elderly people, the social responsible people who should benefit, who should be entitled was coming really from the community. So that really benefited us, and we're also being able to be successful on not leaving no one behind. Leaving no one behind cannot be on structural decisions. It can only emanate from the community. So our disaster risk management really was community-based. Community-based. And community-led as well. But again, it's a government support with all cluster arrangement that is in place. And the beauty of Ethiopia is everything is not done by one agency. There is no one agency show as such. It's a multi-agency, but again, not only the government, but also our partners under the cluster arrangement were on board in addressing the multi-hazard situation of the country. On that, I think we have been very successful. Finally, yes, the resource mobilization issue was one area where it was emanated from the complex emergency. Resource mobilization, we really made an exercise to have a strategy to bring the private sector, to bring the community, donors, government, and all other colleagues to be on board in terms of mobilizing the resource. But this mobilized resource really have helped us to make a change. Despite all these addresses and challenges, when we evaluate the kind of impact that this complex emergency has created, our agricultural, industry and service sectors were being very much affected. Because of this, our Ethiopian economy had been reduced and the poverty rate has also increased. So these were some of the impacts that came as a result of the complex emergency. I think in the interest of time, thank you from my side. Thank you.
Thank you very much, Mr. Bekele, for sharing those with us. Now, at least we have a better understanding of the complex situation in Ethiopia, especially on the actions taken in times of complex emergencies and the COVID-19 pandemic. And as we mentioned, in the interest of time, we are moving on to our last speaker for today, but we'll have follow-up questions later on. And she is no less than Dr. Valerie Bemo. She serves as the Deputy Director for Emergency Response at the Bill and Melinda Gates Foundation, where she pioneered and executed the emergency strategy to respond to all major disasters in the world. Additionally, Dr. Bemo designed and implemented a critical strategy for agricultural development in West Africa with a focus on Nigeria. With over 20 years of direct experience in the field worldwide, she is passionate on building local capacity for a lasting change. Please join me in welcoming Dr. Valerie Bemo.
Hi, Edwin.
Dr.
Nice
Bemo,
to be here. Yes,
thank you. Thank you for being here. So, Dr. Bemo, what is your opinion about the progress on the localization agenda to round up our discussion and the role that various actors, including donors, play in facilitating the speed and process of localization? In addition, what do you think about the slow progress on the commitments made for the grand bargain?
Thank you. That you put me in a difficult position here, because I think we hear from the different participants all the progress that have been made, but at the country level. Unfortunately, at the international level, it's slow. It's really slow. We know from the World Humanitarian Summit in 2016, there was a big commitment with the Grand Bargain to move resources for at least 25% in 2020. In 2019, when this was checked, at that time, it was about 2% only of resources that go directly in the hands of local organization. And in 2019, it was actually even getting lower. And I think with COVID, we expect it to be lower. That means that if you just look at numbers, there's no progress. There's actually we going backwards from all what we expected. However, I think from my perspective and from what we saw with the COVID pandemic, that actually brought a lot of positive action. That means that for me, the first good thing is that countries from around the world, and we saw it here today, from the perspective of different countries, that they took action. They step up, they took their role seriously, they coordinate, they respond, and they move the thing. Maybe by no choice, because border was closed, then everybody was obliged to actually take care of each of themselves first. And I think for me, that is a big progress that we saw. We also saw that in different countries, and we also saw that today, is that different various sectors were engaged. The private sector, in a lot of the countries, the first time that the private sector were engaged, private hospital, by default, were actually called on to the response, etc. The local NGO, because there was no other way, were able to go. Then, yes, it's really no progress in terms of the donors funding, but I think there's a lot of progress at the level of countries. And only then, with that progress, we can actually track and move the international system. Again, we saw with the COVID, there's a lot of conversation that was going without actually concerning the country from the South or the low middle income countries. And we also seem to see that with the vaccine distribution, that we saw the inequity that have been seen as how the vaccine and how the rich have been going on. Nevertheless, there's still so much progress to be made, and a lot of donors. However, when we discuss, when you see, they're really looking for a better way to do that. And as Dr. Scott mentioned, it's a slow process, and we need to put our hand together to solve this, some of the issue, and to really think creatively on how do we want to move on that in that direction. The first thing is that how, as local organization, a local government, a local thing, we can step up, we can present ourselves, we can actually not expect people to come from outside to tell us what to do. As government, as industry, we have a lot of capacity. I think stepping up is the first thing, because when you want to sit at the table, you don't let's stay too far and to say, hey, put me at the table. You need to, at minimum, start showing up that you want to and you can do that. From the different donors, there's a lot of intention to do that. There's a lot of, however, it's difficult because the procedure, the money, who, and sometimes you go to some country, which organization, there are hundreds of them. How do you do that? How do you step on that? And I think the initiative like APP, who try to consolidate organization together, sectorial together, actually make it easier to actually support multiple organizations with one support. And I think this is where we have to, as a small organization, how do we make sure that we start really support each other? And I'm glad that ADPC organizing it, because it's only when we can start having this South to South sharing experience and actually getting together that we can actually attract the system to be able to do that. And I said again, we cannot do it without talking about us without us. And the best way is like, how do we multiply our voice? How do we diversify our voice to sit at the table? And it's still a long way, but we all can play a role. My message for everybody is that we should not wait for the international to come and change the system. We have the power to actually step up, show we can, and actually push that change. The change can come, like I call it the wind of the change. We usually don't know in which direction the wind goes, but the wind can come from all directions. Then we have to enable ourselves to go in that direction. Thank you.
Thank you, Dr. Valerie, for sharing with us your view on the progress on the localization agenda. I agree that we should do more to ensure progress on the commitments made for the grand bargain. At this point, let me pose follow-up questions to our panelists, because we saw a lot of really good questions coming from our participants. But because we are running out of time, let me just request our panelists to please respond maybe in a couple of minutes to make your responses concise and succinct. And the first question is for Major General Ranasinghe. Sir, what are the key factors that contributed to the success of the approach in Sri Lanka, specifically on promoting the engagement of local actors?
Thank you. Sorry, let me put on the video as well. Okay, right, thank you. So in Sri Lanka, the most important factor was actually the president took the lead. And when the pandemic hit Sri Lanka, though we have decentralized administrative, decentralized hospital mechanism, actually the president personally took the lead, and he said it will be a centralized coordination and administration where we have the decentralized execution and the implementation. So there are a number of important areas. First point was inclusiveness and the engagement. As Dr. Valerie initially in her last statement mentioned, that there is a thing called we for we. So in Sri Lanka, we call it we for us. So it became we for us at the local level. And when it comes to the health protocol, we changed it a little and we said, I for me and my family, because people has to be accountable and responsible for themselves first to be protective against the virus, and then only they can make sure that they can support the community. So number one was inclusiveness and the engagement at the local level, because our local actors are really engaged in all these activities in our normal disaster mitigation, management, and response program. We have the community-based disaster risk reduction program, local disaster risk reduction program, right down to the smallest level. In Sri Lanka, we have the district level, then the divisional level, and then the village level. So right down to that, we have this system. So we incorporated this system with the COVID response as well. So with the COVID activity, we had 4 monsoons and 4 intermonsoons. And we had number of floods, number of landslides, number of safety center activities. With all that, we managed it very in a practical way with positive attitude, with this inclusiveness and public engagement. For that, we had the PPP, that is private-public partnership programs, and where within that local community at the village level, we had this coordination with the support of men, material, and equipment. So earlier, as I mentioned in my initial talk, initially it was an issue where issue of understanding what this issue is and how we incorporate COVID-19 protocols and algorithms into our local DRR and community-based DRR program. Then how we make our people-centric leave no one behind programs connected with quarantine, vaccination, and other safety and security programs, while making sure that people are given the food, medicine, healthcare, and normal social life. Then we had the issue of this education. So for that also, we brought in the online education, so that the media campaigns were very successful in Sri Lanka. The first 3-4, I remember the first 3-4 months, all government and the private media came forward free of charge. So initial I think it was more than 3 months, all the private media came forward and the awareness programs were conducted by all the media or the service providers free of charge in Sri Lanka, making sure that unknown is being delivered and educated to all the people on the health protocols and health guidelines, because it was like fighting with unseen and unknown enemy when it came to this COVID scenario. Right. So then next point is resource sharing and the capacity development. So resource sharing, capacity development, and resource sharing and capacity development. We had one serious issue of quarantine facilities. So the best organization that the president decided was the 3 forces in Sri Lanka, where we had number of training centers, number of capacities, and number of camps where we can provide them very productive quarantine facilities, and the safety centers were developed. So all the quarantine facilities at the initial stage was given by the government free of charge. So all those people who were given on quarantine, given this quarantine by the government free of charge without charging them anything. Then we brought in new systems, identifying the situations. We developed the intermediate care center. These are local, by understanding the local knowledge. So intermediate care centers were brought in. Then home-based quarantine was very successful. Even if you get today, we have large number of home-based quarantine, and that home-based quarantine system was very successful in Sri Lanka. Then provision of food and things. Then again came to a public support and service support to public. So all these things are coordinated and developed by the local agents and local actors. So then that we are using of technology. The technology was very important because tracing the patients, tracing contacts, and following up with the patients, we needed technology. So we used the artificial intelligence even down to the village level. So artificial intelligence was very useful, actively used, and those it really helped on tracing. Like leave no one behind, we had a system, leave no one in hiding with the symptoms. So I had a long list. I think my 3 minutes gone is coming up. So I stop and I'm ready for any answers.
Yeah, thank you very much, Major General Ranasinghe. I think we have a lot to learn from you, and maybe what we can do is offline, we can request more information from you and promote it on our APP website. But this next question is actually directed to our lawyer here in our midst, Dr. Matthew Scott. A webinar participant asks you, how do you move from the legal and policy responses to rights-based and inclusive measures at the local level?
Great, thank you for the question. And I mean, I think listening to all of the presentations and also seeing the really dynamic engagement in the chat, what comes up so clearly is that there's obviously a role for state and the government at the national level and at the subnational level, but it's obvious, and this is inherent in the APP initiative, that there's a clear role for civil society, there's a clear role for private sector and the diversity that is found in local contexts needs to be embraced and engaged with in a practical way. And what that means, if we try to move from theory to practice, to my mind, it starts with decisions being taken. And these could be formal decisions in a government context, but it could also be decisions of local actors to decide we need to push a little bit more for a place at the table, as we were hearing from Dr. Valerie. We make decisions about how to engage and whether to integrate rights-based and gender equal approaches into disaster risk reduction, emergency preparedness for response, building back better in the context of COVID-19. Knowledge is critical, and understanding the diversity in local contexts doesn't come just by making those decisions, but it entails this active engagement to understand that diversity, listening to voices. But also at that national level, there's an importance in understanding diversity, maybe a little bit like Major General Ranasinghe was suggesting with artificial intelligence. We need to disaggregate the data so that at a national level, there might be adequate budget allocation, recognizing that here are deprived areas, here are different groups that aren't getting the services or have difficulties accessing. So that multi-level governance perspective, and as we heard from others, also the multi-sectoral and multi-stakeholder kind of engagement is critical. But I think the final point relates to capacity and tools. And here it's a question about how do you move from these principles that we see reflected in international
Okay, I think we lost Dr. Matthew Scott. Can you still hear us?
guidelines or even more trying, sorry? Am I frozen? We've tried to develop tools. Good, sorry. The final point is that we've tried to develop tools to reflect good practices for localizing rights-based and gender equal approaches. And we can probably find ways of sharing some of those materials either in the chat or on the APP website. So I'll leave it there.
Thank you very much, Dr. Matthew. I saw earlier in the chat box that you were sharing some references and resource materials. So please continue to do so that we can actually get those information out of this webinar. And Dr. Tani, this question is directed to you as well. Related to your presentation earlier, which is really a great program, why was it important for you and the Lean On Consortium that the program focused on reaching the homeless and persons with disability, especially in the context of the COVID-19 pandemic?
Thank you, Edwin. I think we should start with the belief that we have is during the pandemic, especially everyone should have the rights to equitable access to information to make an informed decision, right? To how so they can navigate safely through the pandemic. Unfortunately, as we know, with this unprecedented pandemic situation, there's a lot of dynamic updates in terms of the science, decisions from the government, a lot of efforts that has to be taken. And at the beginning of the pandemic, there's a lot of crisis communication taking place. But I think we would like to change the perspective a little bit, that there is a need to shift a common perspective around, having the homeless, marginalized groups and people with disabilities as target groups. In fact, they should be at the table of the planning, decision-making, and also in the context of the pandemic, twisting and adapting strategies and efforts that are taking place. They should have a voice in the table at the national level decision-making and also at the local level. And that means everyone. So I think that's why we not only do the outreach, but we also, actively learning from each and every processes that take place out in the field, formulated that, helped the consortium, documented that, and share that back as policy briefs, as dialogues, as webinars, so then their voice can directly be heard by people who are making decisions about how to handle the pandemic comprehensively at all level, from the national level down to the local level. The other reason is that we know there's a lot of, what WHO called infodemics, right? False rumors and disinformation, even for people without disabilities and even for the common lay people. But it's even more challenge for people with limited access to information, not only because disabilities, but because actually there are not enough information in the format that are friendly enough for the different needs and the different information perception abilities, but also because there isn't also enough format available for the specific needs of people. And lastly, I think the peer counselors and the caseworkers that has been that we engage themselves has been long time trustworthy people to go to people for the marginalized groups. But even they themselves were affected by the pandemic in the terms of health and also in the socio-economic. So by engaging them professionally and not just as volunteers, with no incentives, I think we also provide them with a little buffer so they can continue feel a bit more comfortable, although they don't have the same income, etc., because they're also affected economically, but they can still continue their services for the people in need, just like they did before the pandemic. And lastly, I think it was also very important that we have the opportunity to be convened by the National Disaster Management Agency. And that puts us in the highest level of hearing table in terms of all the aspirations and all the learning that we have from our models and from the very brief 13-month responses. All those experience feedback into the National Disaster Management Agency larger plan. In fact, they have this grand plan, master plan for more resilient Indonesia. And it was already, from the very kickoff of the program, it was already affecting the paradigm and perspectives within the BNPB about what it means to be more inclusive in general disaster management, not only pandemic. Thank you, Edwin.
Thank you, Dr. Tani. Actually, we learned a lot from your response. And I think those are very simple, but very strong messages to bring them to the table, not to treat them just as recipients, but actually active agents of change for themselves, and to engage them as professionals and not just volunteers. Thank you again. Terima kasih, Dr. Tani. I believe that our next question is for Mr. Iyad Agha. And the question is like this, what are the key challenges that you have faced in ensuring that the development initiatives contribute to resilience building of local communities and vulnerable populations, given your presentation?
Thank you. Actually, we can categorize the challenges that we have in two main categories. The first one is in the argument of sustained solutions and development initiatives in opposed to emergency response, in which the prolonged crisis that we have always force us to go back and start working on basic needs, such as providing shelter, water, and food. So the mindset of the operational actors is finding that fine balance in which they can do the more sustained, the longer term initiatives, while maintaining the accommodating the needs of the people as they arise. And unfortunately, the crisis in Syria has been a crisis on top of a crisis. So we always have additional things that we have to deal with. So to begin with is, in addition to the armed conflict, we have natural disasters on winter when we had floods, and we do have now the pandemic, the economic deterioration and whatnot. So basically, that's the way how, this is how to balance our interventions to provide the longer term solution, to have it within our exit strategy, that if we're not there, if we are as humanitarian actors not there, the communities still continue to receive their services by maintaining that service provision by themselves. The second category basically will be for local actors in general. So providing that local actors have what it takes to come in and to ensure that they have their inputs to the planning is actually subsequently will have that the development initiatives will have, but it's not to the perfect situation. We always can do better. And basically on this one, what we do is right now, and this is general because we had this conversation in the localization dialogue that we initiated here this year as part of the groundbreaking initiatives to some of the focus countries. So we found out that the interpretation of localization is quite different between international actors, local actors, and even local actors among themselves. Our focus is always going to be on enhancing the capacities of local actors up to the level where they themselves become more of international entities. Therefore, the localization is not providing support and enabling local actors, but rather transfer them from local actors to international ones. And this is something that we heavily need to analyze and to think how we're doing the implementation of the localization, how we're moving forward with it. Is it by creating copies of international entities rather than maintaining the local actors as they are, enhancing their capacity and maintain that link to the local communities that they have? Thank you. Back to you.
Thank you, Mr. Agha. And I think what I really learned about from your response is that those challenges are quite daunting. But I agree with you that through collaborative work, those could be successfully addressed. And especially like the way you said that we need to elevate their status, not only being attuned to the local needs, but also at the international level. So my next question here, coming from our participants, is for Mr. Tadesse Bekele. Sir, in the face of challenges in Ethiopia, could you please name maybe one or at most two factors that contributed to the effectiveness of the actions undertaken there?
Okay, thank you very much. We wanted to address emergencies through development, meaning emergency by itself is something that will focus on crisis, but the policy supported us how we can respond to emergency through development program. A good example of this is our social safety net program, which is under social protection, whereby we have most chronicle food insecure people being clients to the program. But again, out of this many people, roughly 15% of the people are disabled, elderly, lactating mothers, people with HIV, whatever. So these are people whom we wanted to leave no one behind. But again, the most able persons are with conditionalities to be engaged in public work, and the public work is to address risk. So we decided how we can reduce the risk by putting our emergency beneficiaries to be enrolled in the risk reduction exercise. So for that, we were being benefited, and at the end of the day, the ones whom we are now putting in the social protection will be expected to graduate and make themselves self-sufficient. That's one area where we highly focus. The other area, half of the country has now a disaster risk profile. This profile is done not by the government, it's done by the community, identifying the kind of hazard that they have, identifying the level of vulnerability in that area, their capacity. Then based on this measurement, with the full involvement of the community, we are now able to identify the risk. So once we identify the risk, the community will prepare their contingency mitigation plans, contingency plans. So these plans will be triggered by the community with payment to be made to save their lives and to build their asset. Our expectation is by giving them cash or food, we don't want them to be continuously under this support. We wanted them to be self-sufficient and graduate. The graduation can only come when risk is underlined and when risk is reduced. So the policy which entails managing crisis, shifting to managing risk. This is an area where we are boldly working, and this is done with humanitarian development peace nexus. With this is working with a bigger picture of mainstreaming. This is done by a multi-sectoral approach. And again, the political will, the political commitment, and the community enrollment has really helped us to make this being realized and to bring more self-sufficient people, which at the end of the day will be able to absorb shock, and at the end of the day, again, to be resilient. So I think there are some good indications that people started to absorbing shock. This comes as a result of reduction risks. Again, we hope the vulnerability will be reduced, and risk will definitely be, along with this, will be reduced as long as we build the capacity. Without building the capacity, we cannot expect any development. So we are by and large focus on risk reduction and risk mitigation exercise. Thank you very much.
Thank you very much, Mr. Tadesse Bekele. And I like what you said in terms of capacity building, because I think in terms of pushing forward with the localization agenda, capacity building of local actors is really crucial. So I like the idea that it's being done in Ethiopia as well. And our final question is directed to Dr. Valerie Bemo. One of our participants actually asked you this two-pronged question. Dr. Valerie, do you think achieving the localization agenda is a reality, or is it a fantasy because of what you mentioned earlier? And learning from the COVID-19 pandemic, what are your recommendations coming from a donor's perspective for promoting the localization agenda? Dr. Valerie, please leave us with your key message as well.
Thank you. It's not a myth. It's a possibility. It's just that the how we'll get there is the $100 million questions that all of us will have to answer. But I think we have to be patient, but we have to be also creative. As I said, the table is for everybody, and we're already showing that it's necessary. The first thing is that we can still waiting for donors, but how can we tap our own resources from the community themselves? If ourselves at the country level, we can't even trust that our community think or have a lot to offer, why do we expect some other people outside to bring that fund? We have a lot of funds in country, a lot of resources from the people, and as long as we stop even calling them, seeing them as a benefiting, and see them as actor, a participant, as sitting at the table, that is the first thing. We have to actually start trusting they can themselves, or we can ourselves think. The second piece is that we have to be able to first be bringing our voice a bit louder, a bit more structure, a bit, and to bring it louder, we don't go individually to bring this voice. How do we become more as one, as integrated, and not by dividing? Because a lot of the time we also see a lot of different small intentions coming and it becomes chaotic. How can we organize ourselves better to actually put that weight and that pressure? And I think as the donor, we at the Gate Foundation, we have been investing, we have been pushing, and to say the truth, there's a lot of good intention, and I really want to have everybody to have that. I'm always an optimist. I can see the light, but that light is how do we get there? We only can get there together. And I think we should not position ourselves and them and us. It's again the same issue of inclusivity and diversity. We cannot say the donors and us, the beneficiary and us, the victim and us, the government and us, the private sector. No, unless for us to achieve it, we have to go in a we. We supposed to be a we society and us and together. And the only that we can achieve it, but also knowing that resources are scarce, and then we have to improve our quality. And how do we do it? How do we become more steward of the resources that we have? Because that is really important. And how do we become more creative? There's more disaster coming. There will be an increased disaster. We know it. More conflict, more displacement, more natural disasters. And there's no way that we can achieve it. We saw the increased amount of dollars that are put in, but the gap increasing. We went from 20 million only less than 10 years to now almost 36 billion of fund, but the gap are still high. It's the biggest gap on all the appeal this year. That means that we will be able to sustain. We have to be a bit more creative in how we use our resources, but also go hand to hand. And the more we'll become a we, the better we'll be able to do, and always see everybody at the table and not see the people who are affected by disaster as the victim or the beneficiary, but as part of an actor, because then we can see that everybody, it's not about no one behind, but it's about everybody have something to offer at the table. Thank you.
Thank you very much, Dr. Valerie, and for your critical insights on the current efforts to achieve the localization agenda. Really, there is a strength in numbers, and we need not see each other individually, but we need to work together. The long-standing need to recognize the crucial role of local actors in resilience building has come to the front and center now that we have the COVID-19 pandemic. It must be viewed as an opportunity for us to fast-track localization. And there is a window to support and empower local and national actors in their development initiatives. Like what you said, let us work together to support and amplify their voices. So on behalf of the Asian Disaster Preparedness Center, ADPC, and the Asian Preparedness Partnership, APP, thank you once again to our dear panelists for sharing with us valuable insights and experiences in ensuring that we leave no one behind in our humanitarian action and development work. Thank you as well to all of you who tuned in on this webinar and stayed with us until the end. We hope that you found this helpful. We look forward to seeing you all again, albeit online, in our future events. This is Edwin Salonga signing off. Thank you. Stay safe and well.